Hi, it's Rick Wersch. I'm here to do my week 2 SOAP note. It's adult geriatric, adult or geriatric musculoskeletal, and I had to do a patient profile request for this because right now I'm doing pediatric rotation right now. So BC is a 65-year-old Asian American female who is a reliable historian and came into the clinic with her husband. She states that her knees really hurt as the chief complaint in doing my HPI. The onset of pain started about 6 months ago. The location is in both knees, and it's been going on for the whole 6 months. She describes it, or the characteristics of it are aching and grinding. Um, Things that aggravate it are prolonged sitting when she's using her knees a lot, and then at the end of the day, she also says that they hurt. She's tried taking Tylenol, and that didn't really help, so she stopped. The pain doesn't radiate anywhere. The timing, she says she's more stiff in the morning for the first 10 to 15 minutes. And then the severity is it hasn't really stopped her from doing her activities of daily living, it just hurts. So some pertinent past medical history would be 20 years ago she had to have her right knee surgically repaired because she had ACL and meniscus injuries. She also has a history of kidney problems, which is important for the plan of care. So, and she's overweight. The differential diagnoses I got were osteoarthritis, most likely because she's stiff in the morning. She doesn't have any big nodular swelling, and it's in her knees. And she has had some injuries. The next differential diagnosis is rheumatoid arthritis. That tends to be more in the small joints. It can happen in any joint, but it's less likely. And then my last differential is patellar femoral pain syndrome, where she's hurt her knee in the past and there's pain. Um, if we can't explain why she's having this pain in any other way, then that would be the diagnosis that I would go for. But the primary diagnosis is osteoarthritis. So the plan is to get x-rays of her knees and then do some blood draw, CRP, ESR, and then CBC just to rule out any systemic disorders, like a can't miss diagnosis of like a septic joint, which is unlikely with this patient. We're gonna try having her do some different NSAIDs, ibuprofen, naproxen. We gotta talk about her weight where it is contributing to her knee pain. So diet, exercise, and then with the exercise, low impact activities like biking or swimming, and anti-inflammatory diet, avoiding meats and dairies and things like that. And then if that plan doesn't work, she can come back in a couple of weeks and we can do some knee injections. Thanks for watching my video. Bye.